Welcome. Let's look at the thoracic vertebrae. The thoracic vertebrae form the posterior part of the thoracic cage. This is the thoracic cage highlighted in white. And the posterior midline region of the thoracic cage is where we have the thoracic vertebra. These are small pieces of bones that are arranged one on top of each other. These pieces of bones are held together by intervertebral disc. And this is the thoracic vertebra highlighted in red. And also, if we look at the alignments that the thoracic vertebrae form with the ribs and also the sternum, we know that the ribs span from the thoracic vertebrae posteriorly and it spans through anteriorly to be inserted on the sternum. This structural presentation tends to give a form of stability to the thoracic vertebrae. So if you compare it with the cervical that is not connected to any other structure and also the lumbar vertebrae, you see that the thoracic vertebrae tends to be stable among the set of the vertebral column. This forms the second segment of the vertebral column. We have the cervical vertebra above it, and inferior to it, we have the lumbar, and inferior to the lumbar vertebra, we have the sacra and also the coccyx. So this is like the second segment in the vertebral column. It is seen between the cervical vertebra superiorly and also the lumbar vertebra inferiorly. All in all, we have a total of 12 thoracic vertebrae. We have from the T1 to the T12 thoracic vertebrae. And these are pieces of bones that are arranged one on top of each other. So the number of the thoracic vertebrae that we have corresponds to the number of ribs that we have. We know that we have 12 pairs of ribs. We have 12 on the right and 12 on the left. So the number of ribs is the same as the number of thoracic vertebrae that we have, because we know that these ribs will emerge from the thoracic vertebrae and they need to correspond in number, because it is only at the region of the thoracic vertebrae that the ribs are connected with the vertebral column and they need to tally in number. So studying the structure of the thoracic vertebra, the thoracic vertebra are also divided in terms of structural configuration into typical and atypical thoracic vertebra. The thoracic vertebra that are typical means that they have the same structural configuration, and we see them between the second to the 8th thoracic vertebra. While the atypical thoracic vertebra are distinct, are different, they do not present the same structural configuration as what is seen in the typical thoracic vertebra. And we have the 1st, the 9th, the 10th, the 11th, and also the 12th thoracic vertebra in this category. So these, if you study them one after the other, you see that they have distinct features that separate them or that distinguish them from the other typical thoracic vertebra. But for the purpose of this lecture, we would be focusing on the typical thoracic vertebra, checking the structural configuration of what a typical thoracic vertebra presents. Let's look at the structure of a typical thoracic vertebra. Generally, in terms of size, the thoracic vertebra is intermediate between the cervical and the lumbar vertebrae. So generally, the thoracic vertebra is seen to present the body or the centrum, and this is the body or the centrum, harrowed in red. This is like a thick mass of bone that is seen in the anterior part of the thoracic vertebra. This is the anterior region and this is the posterior region. So in anatomical position, the centrum is directed anteriorly, and this is like a thick mass of bone as we've seen, and this thickness is to allow it to be able to carry the superior thoracic vertebra. So this is created as a strong force that can help to hold the thoracic vertebra that is located above it. As we have said, that there are small pieces of bones that are arranged one on top of each other. And of course, it is onto this platform that the intervertebral disc is seen. We said that the intervertebral disc are used to hold these pieces of bones together. So it is on the centrum that we have the intervertebral disc located. Also, to drive further, we've said that this is the anterior region and this is the posterior region in anatomical position. This is how the thoracic vertebra is placed. And if you look at the posterior extension from the body, we have a structure that is called the pedicle. This is the pedicle, arrowed in purple. So we have one extension on this side and we have another extension on the other side. Also going further, we have another region that is harrowed green, and this had the lamina. These lamina are also extensions that are seen from the pedicle, but this tends to be directed along the median plane. And if you look at the pattern by which the lamina runs, you see that they are directed towards the median plane. They are directed towards the median plane in the quest of forming the spinal process. So if you look at the alignment or the configuration of the centrum and also its posterior extension, that we call the pedicles, then also further extension that is called the lamina, we have the creation of a foramen, and this foramen is called the vertebral foramen, which simply means the foramen of the vertebral column. So this foramen is for the passage of the spinal cord and its associated meninges, and also for the passage of the spinal vessels. So this is where the spinal cord passes through downward. So this is created by the alignment of the body anteriorly. Then laterally, we have the pedicle, and more posteriorly, it is being bounded by the lamina. So this is the vertebral foramen. Then going further, we have the spinal process. The spinal process is one, and we've said that the spinal process is formed by the union of the right and the left lamina. And this is the region that is highlighted in green. We said that this lamina, the way they run, they are directed towards the median plane. And the reason for this direction is to allow the emergence of the spinal process. And this is the spinal process. It is directed downwards and also posteriorly. And this is how the spinal process emerges. We have just one, and this is basically for the attachment of muscle. We also have the transverse processes. These transverse processes, from the name, it runs along the transverse plane, and there are two in number. So we have one on the right and one on the left. Remember when we talked about the pedicle that emerges as a posterior extension of the centrum or the body? This is the region that is highlighted in purple. Following this emergence, we have the transverse processes emerging between the border of the pedicle and also the lamina. So this is the transverse process of one side, and we have another transverse process on the other side, making it two transverse processes. And these tend to run posterior laterally, and they are also for the attachment of muscle. Also to add that we have the superior articular facet. This is the superior articular facet in this region, and we have another one on the other side. What the superior articular facet does is to create a platform onto which the superior vertebra will articulate with, because we already said that there are small pieces of bones. Even though we have the intervertebral disc that is helping to structurally connect these bones together, we also have the creation of articular facet, and this is seen around the junction where the transverse process emerges between the pedicle and also the lamina. So this is the superior articular facet, and this facet is to allow the articulation of the superior thoracic vertebra. If you also look at the pattern by which this facet emerges, it tends to be directed backward and also downward. So it is not seen as it is presented here, and this is what allows for the rotation of the thoracic vertebra, because it's able to give a free wheel at the anterior side so that the thoracic vertebra can be able to exhibit rotation. So it is as a result of the direction of this superior articular facet that is said to be directed posteriorly and also downwards, thereby giving allowance for a rotatory kind of movement. Also, because we have a superior articular facet, we said that in anatomy, when we have specificity in terms of names, we have superior articular facet, we should have an inferior articular facet. It means that in the inferior part, if this bone is tilted upward, we have also an inferior articular facet, and this inferior articular facet will be used to articulate with the inferior thoracic vertebra. So that is how they are being presented. So going further, let's look at other distinct features of the thoracic vertebra. When a thoracic vertebra is placed, maybe during steeplechase exam, and you are asked to identify the bone, what are the other distinct features that you would see and you would be able to establish that this is a thoracic vertebra? We've talked about the spinal process. We said that this is the spinal process. In the thoracic vertebra, they are longer and are also directed downward. If you look at this diagram below, you see that this is the spinal process, and the way they are directed, they tend to be directed downward. So this is a feature that separates them from the other thoracic vertebra. So this is the spinal process that appears to be longer in the thoracic vertebra. Then going further, we have the vertebral body. The vertebral body is also referred to as the centrum, and this is the vertebral body. We said that is a thick mass of bone. In the thoracic vertebra, It has a heart-shaped structure. So if you look at the way it is configured, it is not rounded, it is heart-shaped. So this is another characteristics or feature that distinguishes the thoracic vertebra from other vertebral bones. More distinct features that are seen within the thoracic vertebra are the costal facet. We know that within the region of the thoracic vertebra is where we have the connection of the ribs. So for the thoracic vertebra to be connected or to be articulated with the ribs, they need to have facets that will receive the ribs for this connection to be established. And that is why within the thoracic vertebra, we have costal facet. So let's look at where the costal facets are located. This costal facet, from the name, we know that they are for the articulation of the ribs. So we have 3 costal facets on one side. We have 2 on the body and we have 1 on the transverse process. For the body, we have the superior costal facet, and this is the superior costal facet. More inferior, we have the inferior costal facet, and this is the inferior costal facet. So we have 2 facets on one side of the body. So if you go to the other side of the body, we also have the superior and the inferior costal facet. So making 4 costal facets on the body. We have 2 on one side and also 2 on the other side. Then on the transverse process, we have 1 on one side. So this is the transverse costal facet. This transverse costal facet, we also have another transverse costal facet on the other side. So making a total of 2 transverse costal facets. So in totality, we have 6. We have 3 on one side as it is being presented here. On the other side, we also have 3. So we have 2 on the body, we have 1 on the transverse process. So we have a total of 6. For the body of the thoracic vertebra, where we have the superior and the inferior costal facet, it is for the articulation of the head of the ribs. Also, on the tubercle of the ribs, we said we have another facet, which articulates with the transverse process of the thoracic vertebra. You can see that the different regions of the ribs are connected with different regions of the thoracic vertebra. This will also establish as we go further with this lecture. So going further, to see the specific regions of the ribs where they are connected with, we already said that we have 3 facets. We have 2 on the body, the superior and the inferior facet, and we have 1 on the transverse process. And we said that as it is presented here, we also have on the other side. These facets are connected to specific regions of the ribs. So let's see how this is established. The facet seen on the body, we already said we have a superior facet and an inferior facet on the lateral side of the body. And of course, these are connected to the head of the ribs. This is the ribs highlighted in red in this region. So let's see the pattern by which they are connected with the body of the thoracic vertebra. This is the ribs, this is the head. After the head, we have a constriction that is called the neck. After that, we have the tubercle. On the head of the ribs, we have 2 facets. We have a smaller superior facet and a bigger inferior facet. Those are 2 on the head of the ribs. While on the tubercle of the ribs, we have 1 facet, and this is the facet on the tubercle. Well, we said that the facets that are created on the body of the thoracic vertebra are connected with the head of the ribs. And you can see that we have a corresponding number of facets on the body, which are 2 superior and inferior facets. Also on the head of the rib, we have 2 facets, which are the superior and the inferior facet. But let's see how they are connected, because they have specific pattern by which they are connected. So this is the head of the rib. In this structure below, we have the superior facet and we have the inferior facet. So this is what happens here. The inferior facet on the head of the rib is connected to the corresponding thoracic vertebra, but the specific region of the corresponding thoracic vertebra that I connect with is the superior facet. We already established that this is the 4th thoracic vertebra, and superior to it, of course, we have the 3rd thoracic vertebra, and this is the 4th rib. So the inferior facet on the head of the 4th rib will articulate with the superior facet of the corresponding thoracic vertebra, and that is the way it is established. Now we are left with the superior facet on the head of the rib. This superior facet on the head of the rib will then be connected with the inferior facet of the superior thoracic vertebra, and the 3rd thoracic vertebra, of course, falls into this plate. because the ribs actually at the end will now be connecting with the corresponding thoracic vertebra and also the thoracic vertebra that is located above it. And this is the pattern by which they are connected. So at this joint, we have the costovertebral joint, which is the joint that is created between the rib and also the thoracic vertebra. And this is the costovertebral joint created between the head of the rib and also the body of the thoracic vertebra. Also going further, we already said we have another facet on the transverse process. And this is the transverse costal facet on the corresponding thoracic vertebra. We already established that this is the fourth rib and this is the fourth thoracic vertebra. If you look at this image up here, that after the neck, we have the tubercle, and on the tubercle, we have another facet. So it is this facet that we articulate with the facet that is created on the transverse process of the thoracic vertebra. That is what is created in this region. And this region is where we have the formation of the costotransverse joint, which is the joint between the ribs and also the transverse process of the thoracic vertebra. All we need to do is to always break the name down in anatomy for us to know the structural components of those words. And for the costotransverse joint, we have the joint created between the ribs, which is the costal, and transverse, of course, the transverse process of the thoracic vertebra. So that is the way or the pattern by which the ribs is connected with the thoracic vertebra. So we have a connection around the head of the ribs, which is the articulation formed on the body of the thoracic vertebra. And we have another joint or articulation that is created between the ribs, but specifically in the tubercle, of course, with the transverse process of the thoracic vertebra, and that is how they are established. So at the end, we now have a single rib connecting with the corresponding thoracic vertebra and also the superior thoracic vertebra. And this is the pattern by which this is presented. You can see how interesting this is. So we have at the end one rib connecting with two thoracic vertebrae. And what this kind of presentation does is to give structural stability to the joint that is formed between the thoracic vertebrae and also the rib. So let's look at the intervertebral foramen. Just as the name implies, the foramen that is seen between two thoracic vertebrae. And this is also referred to as the neural foramen because it allows for the exit of the root of the spinal nerve. And it is the space that is created between two thoracic vertebrae. If you look at the image down here, we already established that this is the third thoracic vertebra and this is the fourth thoracic vertebra. So the intervertebral foramen is a space that is formed by the third and the fourth thoracic vertebrae. And this is the intervertebral foramen that is created between two thoracic vertebrae. And in this regard, it is created between the third and the fourth thoracic vertebrae. But how is this foramen created? This foramen is created as a result of the indentation or depression that is seen around the junction of the pedicle and also the lamina. Remember when we discussed about the structure of the thoracic vertebrae, we said that a posterior extension from the body is the pedicle, and this is the pedicle. And of course, we have a further extension from the pedicle, which is the lamina that tends to be directed towards the median plane, which then finally forms the spinal process. So around this region, we have indentation that is created both at the upper and also at the lower part. At the upper part, we have the superior intervertebral arc. Also, if this bone is tilted at the inferior part, we have a similar depression that is seen below, and this is the inferior intervertebral arch. These two will come together to form the intervertebral foramen. So let's see how this is demonstrated using this image below. If you look at the third thoracic vertebral, you have a shallow depression that is created above it. And this is the superior intervertebral arch. This is shallow, while the inferior intervertebral arch, which is created below it, is deep. So you see that one is deeper than the other. And of course, it is the inferior that is deeper. So we have, for a single thoracic vertebra, you have a superior intervertebral arch and you have an inferior intervertebral arch. But how is this foramen created? Let's dive in to see how this is established. If you look at this space where we say the intervertebral foramen is created, you see that it is circular alignment of the foramen is formed by the inferior intervertebral arch of the third thoracic vertebra and also the superior intervertebral arch of the fourth thoracic vertebra. So the two will unite to now form a foramen that is called the intervertebral foramen. So that is how the intervertebral foramen is created. This is the superior intervertebral arch of the fourth thoracic vertebra. We have the inferior intervertebral arch of the fourth thoracic vertebra. And what the intervertebral foramen allows is the exit of the root of the spinal nerve. We already established that we have the central vertebral foramen using this image up here, and this is where the spinal cord pass through. And of course, we know that around the spinal cord, we have spinal nerves, and the spinal nerves will need to exit the region of this vertebral foramen so that they can innervate different organs in the body. And they cannot exit this region except they pass through the intervertebral foramen, because that is the space that is created for this exit. So they pass through this region that is harrowed in this image. And in this lower image, this is also the region that is harrowed red. So they pass through this region to supply the different organs in the body. So that is how we have the exit of the root of the spinal nerves. So let's look at this brain drill. You may either highlight all the facets on the thoracic vertebra, or you may decide to establish how the thoracic vertebra is different from the other vertebrae. So thanks for watching this video. Let's meet again.